Welcome everyone. It's exciting to see everyone. This is the first CKD network session of 2023. Welcome back to all of you that are returning, and I see a few new names, so warm welcome to new members of the kidney care community. I'd like to start today by acknowledging that I'm attending this session as a settler on the traditional, ancestral, and unceded territory of the Musqueam, the Squamish, and the Tsleil-Waututh. I'm very grateful for that and encourage you to reflect on the lands you're calling from. A few housekeeping today. I think we have one question already about a call-in number for someone that doesn't have audio. If you do have trouble, just put it in the chat. Make sure to mute your mic. And there will be an evaluation at the end with some suggestions for next topic and ideas. And so with that, we have 3 speakers today, and I'd like to introduce all of them as well as their administrative support that is helping pull all this together. I don't think any of the speakers are new to this group, but I'd like to give a warm welcome to Dr. Meghan Elliott, who's a nephrologist and assistant professor at the University of Calgary, very well trained, and her research interest is in understanding patient care experiences and developing strategies to engage patients and providers in person-centered care. We also have Dr. Mo Donald, who is a physiotherapist by training, who is an assistant professor as well in the Division of Nephrology, who also is doing research and supporting person-centered care and trying to figure out how we close that gap between what we know we should do and what we are doing in healthcare. And a very warm welcome to Dwight Sparks. Dwight lives in St. John's and has living experience with chronic kidney disease, and I must say is very generous with his time. When an email request came out for a presenter, usually I kind of think a little bit before I press OK, but it wasn't even a minute, and it was okay. Happy to. What can I do? So welcome, Dwight. So I will pass it over to the 3 of you to lead our session today.
Thanks so much and welcome everybody. I am very fortunate here in Calgary to work and play and enjoy the environment here by the mountains. And so I'd like to acknowledge that I'm on Treaty 7 territory here, and I welcome everybody else from across Canada today and where they are and living and playing too. So to start off, some of this information that you'll hear today will be familiar to some, as we've been very fortunate to present to this group in past. And so thank you for the large participation today that we have online here. So the title of our work today is What's New in Self-Management for People with Chronic Kidney Disease. And so what we're going to do today is things that you hopefully will take away from this presentation is that you'll to review the importance of supporting self-management for people with CKD in your roles, be it as a clinician, administrator, as a patient partner, peer support partner. Think about that importance of supporting self-management. The second thing is that we're to provide an update on the web-based self-management intervention, My Kidney, My Health. And also, we hope that you'll learn to we'll provide you with some strategies for implementing self-management resources in CKD clinic care settings. And finally, to provide an overview of peer support needs and practicalities in relation to CKD management. So our agenda for today will include why is self-management important, a review of the My Kidneys, My Health updates and strategies, and adapting and enhancing self-management support, where we're going in the next few years. And then we'd like to open it up for discussion, and we'd like to take up more time on the discussion and answer any questions and provide any resources that you may request or questions that you have. So how we're going to start today is we're going to start with some polling questions to understand who's on the call today and just an idea and the environment and experience of self-management. So why don't we start the polling question? So they've popped up here. you'll see there's 2 polling questions, and please feel free to start with question 1. What is your primary role on this in the setting of CKD care? And the second one, what do you consider to be the top 3 areas of self-management? And these lists came from patients from across Canada that said these are topics important to them for self-management. And we'll continue on. As you can see, you can scroll down in question 3. Are you involved in patient self-management? Yes or no? Question 4. What are the top 3 barriers to supporting patient self-management? In your mind and in your role and context? And finally, question 5. What self-management supports do you provide to your patients? We'll give you a few more minutes to answer those questions and see how the polling's going in terms of response rate.
Mo, do you want patients to fill this out as well?
Sure, please do.
Okay.
Thanks for asking. Yeah. Great, so we got some responses coming in. We'll give it another minute. Okay, I think we'll close that, close the poll, and if we can have some of the responses now posted. So thank you, and I'll quickly go through these. So looks great here. We got a variety of people in terms of who's joined us today. Obviously, I see our top amount is other, so it'll be interesting to that we have some other people, and that I'm assuming might be some patient partners, patients, caregivers on the call. And I see that the next is nurses and nephrologists and administration management and some other clinicians. That's great. In terms of what do you consider to be the top 3 areas, interesting. One is the mental well-being, excellent medication management, food and diet, and just looking down of 25%, so peer support being the least in these top 3 areas.
Oh, on my screen, it didn't go to number 2. I don't know if others have the same.
Oh, can you guys see?
You just need to scroll.
You
Okay.
can scroll down.
Oh, yeah, sorry, put the individually scroll down. Sorry. Can people see it, or should I can just share my screen?
I closed that window when I didn't see the information. So if either you can pop it back up or share.
I can't share my screen, so somebody, if they could share, Selena or Sabrina.
Yeah, I'll try to share my screen.
Excellent, thanks.
No problem.
Great, guys, thanks for bringing that up, Krista.
So I've shared my full screen there. Is that visible?
I don't see it. Do others see it?
How about now?
No. No, I don't see it.
Okay, how about now?
Someone in the chat just said to press the poll feature at the bottom of the screen and it will open back up for the individual. So that worked.
Thanks, guys. Obviously, not a tech person here myself. All right, so let's just, is everybody able to click on their poll screen and look at and scroll down so you can see question 1? Perfect, I see Monica noting it. 2, the top 3 considerations. Number 3, where we left off, are you involved in patient self-management? So see, quite a few people are either yes involved or somewhat involved. So that's great. Great audience here to have this discussion with. What are the top 3 barriers to supporting patient self-management? So some of these, interesting enough, the first one is that patient receptivity or readiness is considered a barrier. Time, that we hear a lot. Resources. And the next, the 4th one I see is knowledge of self-management supports. So those are great things that we hopefully can address today in our talk. What self-management supports do you provide to your patients? So I see some people are aware of My Kidneys, My Health and KFOC tools. That's excellent. And some printable materials. Great. And then refer to other providers. And some coaching and coach and support patients directly in appointments. Excellent. So thank you everyone for completing the poll. That's great. It gives us, I'm hoping that we can answer or address some of the barriers today and have a great discussion at the end here about some of these responses. Next slide, please. So the idea is that the first thing is why self-manage? Why self-management? So many years ago, this was identified as a patient priority and caregiver priority in a James Lind Alliance research priority setting activity. And we were very fortunate to do this work through CanSolve in the first phase of the CanSolve network support. And what came out of that was that patients identified and their caregivers identified that there were key buckets or topics that were important to them that they didn't find information in depth anywhere else, particularly around patients and caregivers that are dealing with early stages of chronic kidney disease, not end stages, or kidney replacement therapy such as dialysis or transplant, but these early stages of kidney disease that these patients were dealing with. And these buckets were demonstrated by this beautiful visual, this roller coaster that the patient partners developed when they looked at the themes that came out of our past qualitative work. And the idea around these topics, some of them are quite familiar, that are greatly represented in materials that you potentially provide, but also KFOC provides. But then there were some of these buckets on topic areas that felt like there were not enough information on. And interesting enough, in the poll, one of the top topics that people identified was that mental health wellness. So something that we need to further develop, but was one of the key areas that was identified in our work previously. The other thing around this visual you see with the roller coasters is not just presenting these topics and educating people around them, but also having supports in place. So these tangible, practical supports in place to be able to provide support for self-management. And also the CKD information, sharing this, but sharing it in multiple ways. So not just in handouts, not just online, but a multifaceted way of sharing information for patients and caregivers. Next slide. So based on that and our work with patients and patient partners, I want to hand it over to Dwight and let him tell you in his own words about his experiences with self-management.
Thanks so much, Mo. I'm so happy to be here to briefly share some of my experience with self-management of my kidney disease. I'd like to draw your attention to the quote on the screen. And I came across this quote in a webinar a couple of years ago, and it kind of stuck with me. But there's something missing about it. I would add like learned or acquired before ability, because this ability to self-manage is not natural and it's not innate for patients. At least it wasn't for me. I go back to the day when my nephrologist told me I had interstitial nephritis, and my kidney function was in the mid 30s, and I was just sitting there dumbfounded, kind of blown away. And he said my kidney function would probably never improve. And the scarring in my kidneys was just too great. I vaguely remember him telling me, "Don't eat salt," and I just like left. Now I don't blame my nephrologist, because given his workload, he just doesn't have time for like personal counseling sessions. So like I went home that day and told my wife, and she was like, "Well, what will we eat? Because like salt is in everything." And I said, "Well, I have no idea." So that was day one, and you're just like, okay, so there began my self-management journey, so to speak. I was motivated, unlike most early stage patients who had no symptoms. I had been really sick that summer, and I knew if there was anything that I could do to avoid getting sick again, I would do it. But I had no knowledge of the disease, and I didn't know anyone who had it. So much of what I've learned came from the internet. Google became my best friend, and from that, I basically changed completely how I ate. I got bits and pieces from all over, but it may come like all over the internet, but it may come as a shock to you. You shouldn't believe everything that you believe on the internet. So you have to be careful where you get your information. I found that in my experience that websites on CKD could be one-dimensional, just dealing with one aspect. Information on like emotional support and medication, symptom management was limited, especially for the early stages. Other times, information from multiple sites could be conflicting, especially around diet. It took me like a couple of years of research before I got to the point where I felt comfortable in the management of my disease. Like my function went up into the 50s, so I knew I must be doing something right. This is one story I have to share. Like I think it was 3 or 4 years after I was diagnosed, I dropped into the local branch of the Kidney Foundation, and we got to chatting. And one of the staff members mentioned that they had this great handbook for people who was recently diagnosed with CKD. It's just like, where was this book like 3 or 4 years ago? But regardless, so you could see from my experience that there is this knowledge gap for early stage patients like myself. And this is where My Kidneys, My Health comes in. This is why I joined the project team. I don't want other newly diagnosed patients to go through the frustrations that I went through and have to scramble to find the information in the same way that I did. If there's one thing that you can take from my presentation, was that My Kidneys, My Health was developed for patients by patients. It's a website, like it's one-stop shopping for living well with kidney disease. It's topics that every patient should know. It was launched in March of 21, and the topics range from like information about the disease itself, medication, symptoms, mental and physical well-being, work and school. There's a section on travel, and this is my favorite section, a food and diet section. So there's guidance on kidney-friendly foods, and you can create your own personal food list. There's also like an important section on how to read like food labels. packaged foods. That's always a lot of people don't realize like how phosphates and salts and stuff like that are in those ingredients. The information is down to earth and very easy to understand. And I'd like to pass that back to Mo again.
Thanks, Dwight, and thanks for telling your experience. And, we've heard from patients like Dwight and caregivers across Canada, but we also further researched this to understand like why I use My Kidneys, My Health as a clinician, and what are the benefits for other patients and caregivers. So what we've heard over the last 2 years of having this out and in the public domain is that it meets the patient need, again, for this population, early stage, newly diagnosed. We've heard that it's easy to use and it can be tailored, as Dwight said, like you can find foods, you can identify which are high in certain nutrients. And also, we have this initial data that shows that it may improve self-efficacy and support self-management. Again, what we heard from Dwight and his story is he was already engaged in wanting to learn and understand and manage his condition when he found out. So obviously, My Kidneys, My Health is there, but you can't force people to use it as a patient or caregiver, but when they're ready to use it, and that's a key thing, is understanding when patients and caregivers are ready to take in this information and let them choose to decide that. When we looked at the literature and look back at clinicians' experience, a lot of them based it on disease, the disease stage or category, versus when patients identified when they wanted to learn more about their disease and how to manage it. And the benefits from patients, we heard, as these interactive tools to help support conversations, like that question list that you can build and tailor the questions to bring to your clinician. So in terms of you on the call as benefits for care providers, it can support your patient education and self-management for, as I mentioned, that population, and that it is based on evidence-based resources, guidelines, and it's reliable and consistent. And it ties beautifully in with the Kidney Foundation of Canada. We've worked over the last so many years from the beginning, the initial start of this work, with the Kidney Foundation of Canada, because we don't want to duplicate. We want to make sure resources are brought together. And with that in mind, I would like to highlight the work that's been done by the Kidney Foundation around the Kidney Wellness Hub. So in terms of the Kidney Wellness Hub, we see two things here. One, the Kidney Wellness Hub provides that information around wellness, around that self-management support, key to wellness. And the My Kidneys, My Health provides that support and self-management guidance around more the medical side of things, like the diet and things like that. So in terms of how we fit together, we have links both ways from My Kidneys, My Health to refer people to the Kidney Wellness Hub. And you can see these highlights that the Kidney Wellness Hub supports. And some of you might have used it and directed patients to it, but they have a lot of great materials, videos that patients with kidney disease are teaching activities like yoga. So very, very community-based. And here's another slide showing some of the key things that they do provide that are supported by members that have kidney disease themselves. So the staying active, the mental well-being. So, for that one comment about that was a key area, one of the key areas or topics that need to be addressed for self-management. The Kidney Wellness Hub has information there, eating well, and then that social connecting, that peer engagement, which we'll hear also more from Meghan. Next slide, please. So My Kidneys, My Health updates and the strategies that we have done. So just for those that have seen our work over the last few years through presentations, basically we're at the stage 5 where we're developing and evaluating implementation strategies for clinical practice. So what we heard is it's great that this is out there for patients and the community members, but how can we how do we support clinicians in either multidisciplinary care clinics, in primary care, in the CKD clinics, to build this into their practice without disrupting their practice. So we've just finished up an implementation study here in Alberta to understand the barriers and facilitators in primary care and in the kidney world of how to put this into practice. So these probably, like you've mentioned or you saw on the poll, some of the common barriers for providers are awareness of the website. So that's our role, to go out and be able to disseminate this work through our different dissemination strategies to different audiences. For providers, they said remembering to share the website while they're in clinical practice or with the patient, and time, which we saw on the poll, to show the website to patients. And what providers indicated, what they perceived that might be patient barriers is obviously the accessibility to a website if you don't have internet or devices to use the website, and also concern whether patients will continue to use the website. And so based on this feedback, we developed some implementation strategies that we'd like to share with you today that we will also can provide to anybody that's interested. Next slide. So before we share those, we want to go through some cases. So it kind of highlights how clinicians have used this in their clinical practice and helped us develop implementation strategies. So we have Mr. Smith here, who's a 70-year-old male, recently diagnosed with CKD. He's retired, not comfortable with using web-based tools, but feels overwhelmed and doesn't know where to start with his management of his disease. And so what we can provide is what we heard is these are some strategies to help clinicians. So discuss and write down wellness goals. So talking about his goals with Mr. Smith. Walk through relevant components of My Kidneys, My Health pages. So not having to overwhelm them with the whole package, the whole website, but to talk to them about things that he would be interested in based on his goals. So I want him to know, what medications can I take or should I avoid? You know, what food, as Dwights said, you know, being told to limit salt or sodium in his diet, like really tailoring it to those pages of the website. Printable materials for them to review at home, so to take home with them. And schedule follow-up to assess readiness for other tools. So, you know, next appointment, seeing if they could use something else and linking them to the Kidney Wellness Hub, for example, for peer engagement. Next slide. Here's a second case, Miss Gomez, who's younger, 30-year-old female, early stage CKD. She's working, she's tech savvy, I'm worried about the impact on her lifestyle. So to be able to work, to probably, she might have a family. And here's some strategies that we've heard and people have used in the clinical practice, is again, to discuss and write down those wellness goals that are important. We have postcards to share, to review at home, My Kidneys, My Health. So it has a QR code that she can scan in and go right to the website. Highlight relevant pages. So classic thing again, what are her goals? Match those goals to the areas of the website that would be meaningful for her to self-manage. And then that's scheduling a follow-up to assess readiness for other resources. Next slide, please. So in terms of implementation tips that we heard from our implementation study is when you could share that link before or after appointments. You can walk through the website during an appointment, depending on your role. We've heard from some nurses and dietitians and pharmacists that they say they do have the time and they appreciate having that time to walk through key areas of the website that are tailored to their patient. And you can print a poster and put it on your wall. Again, all these things like a postcard, poster, we have these resources that we can share with you. How do you share it? Highlight sections based on their needs and goals. They can highlight videos, interactive features, and incorporate a link or the postcard into your communication. So if you're doing or secure messaging communications, emails, you can link the QR code and then they can go to it. And who can share this website? Basically, anyone on the team, clinicians, nurses, pharmacists, dietitians, and share it with patients with CKD or who are at risk of having CKD. We heard that too. People wanted to know, I am concerned there's a family history. How can I start engaging in my self-management? Next slide, please. So I'm going to hand it over to Meghan.
Thanks, Mo. Can you hear me okay? Yeah. So thanks so much for having us today. Mo and I and Dwight and the whole My Kidneys, My Health team have been working together for several years. In parallel with this self-management work, I've been doing a lot of research with my team around peer support and the role of peer support in helping people to live well with their kidney disease. So in this next phase of the My Kidneys, My Health and self-management interventions, we're looking to marry the two or find ways of bringing peer support into the self-management program. Next slide. So I show this slide in this quote quite often in my presentations because it came out of a study we did several years ago, but I found it so powerful. And I keep coming back to this quote whenever I think of my work and my purpose and what we're doing going forward. I'll just read it to you. It's quite an isolated personal space. You wait in the hall to see your doctor. You go in and you meet your doctor, then you leave and you're back home again. Rarely do you ever meet or interact with another patient. And this came from a person who at the time had pre-dialysis or nearing dialysis kidney disease, who has since gone on to receive dialysis. And I think it really speaks to the potential lack of supports that people have, the lack of community, really just focusing on the medical aspects of kidney disease and not realizing that there's a whole community of people who also are living with kidney disease who we could potentially connect you with. Next slide. So as I mentioned, the self-management project has been going on in parallel with a lot of the peer support work that we've been doing behind the scenes at the same time. The idea of relying or turning to peers or people who have similar experiences with kidney disease, it's not a new idea. It's come up again and again in different projects, in different clinical contexts, and just speaking with friends and patients. For peer support, our journey with the peer support world has started a few years ago, where we started with a qualitative study with focus groups to look at perspectives on peers supporting people living with kidney disease. And we went on a couple of years ago, actually we prefaced the survey with a previous CKD Clinic network presentation talking about peer support. So I'll show you some of the results from that survey a couple of years ago. A consensus workshop, which was about a year and a half ago, where we brought together clinicians, patients, loved ones and support persons, as well as peer mentors from the Kidney Foundation to identify some priorities for peer support in kidney disease. And then a review of the literature that's ongoing with our group and almost finished. And the next slide. You can, advance the animation, Sabrina. So in our initial qualitative studies, what we found or heard from patients is that beyond what the medical team can provide, we know that in clinic, we pile on information, we try and cram as much information as we can into these short encounters with patients. But what people really have found helpful is hearing this information from various sources, which can include other people who have lived experience of kidney disease. So finding out what it's like to live with the disease, what they might expect down the road, and importantly, knowing that they're not alone. People who have advanced kidney disease, who are not yet on dialysis, we hear again and again, it's an invisible, or it can be an invisible condition where you can't tell by looking at someone if they have kidney disease. So it's really hard to connect with other people who are in the same boat. And ultimately finding pragmatic strategies and approaches to live well with kidney disease. Now, from our survey that we did last year, the year before, we spoke with healthcare providers and administrators from kidney care clinics across the country, and we had respondents from a wide range of provinces. And what we found was overall awareness was pretty good. About 3/4 of respondents were aware of existing peer support programs. It was highest in Ontario and Quebec, and it was quite low from the Atlantic province respondents. About 1/3 of people in Atlantic Canada were aware of existing peer support programs. In terms of healthcare providers, it seems that the social worker respondents were the ones who were most likely to be aware or know about peer support programs and to be the ones referring people on to peer support programs. The key barriers that healthcare providers and administrators told us about in terms of integrating peer support into their practices were workload demands, time constraints, having a lack of process to integrate this or embed this within their kidney care, and accessibility concerns, both having access to the programs as providers and also concerns about patients' ability to access the programs. With a consensus workshop, we identified some key priority areas or needs regarding peer support. The first relates back to that awareness piece. We can't provide or refer or recommend peer support if we don't know about the programs that exist. Having flexible peer support options, so being really able to adapt and tailor it to what a person needs at that point in time, because we know people with kidney disease, their needs and what they need doesn't stay constant throughout their journey with kidney disease. There's lots of ups and downs and things can change quite quickly. Having the ability to match a peer supporter to a person, so not just pairing up with any volunteer, but really taking that next step to find out, okay, who is the best person to actually match someone up with to provide this support? And again, those accessibility concerns, and it could be related to geographic location, so being rural or remote and maybe not having access, the same kind of access to these programs, cultural or language barriers and accessibility concerns. If someone is not an English speaker, for example, how do we match someone up with them who can speak their language? Next slide. And then an ongoing, nearly completed scoping review that we're doing. What we did was look at existing peer support programs internationally to see which ones have reported on their programs and evaluated their programs. And there's really a smattering of different kidney disease populations that they cover. So some of them focus on dialysis specific population, some of them are for non-dialysis people, some of them are with transplants. And most programs that are out there are a one-on-one type program rather than a group meeting format. And most are an in-person, but although several do have telephone or virtual options as well. In terms of referral, so most of them are open to anyone. Okay, so they're not targeted programs that are only offered to people meeting certain eligibility. It's really anyone with kidney disease is offered or has a program available to them. A minority were relying on clinicians or healthcare providers to refer them on, and around the same amount relied on peer matching. So again, matching people based on their needs or certain characteristics. And most programs focused on providing that information. So what it's like to live with kidney disease, practical diet and medication recommendations, et cetera. You can advance, Sabrina. So what we learned is that there are a lot of programs out there. There's 50 different interventions that we identified. And so rather than reinventing the wheel, why don't we consider leveraging or using what's already out there, or borrowing characteristics from other programs. In Canada, by far and away, the most commonly accessed peer support program is Kidney Connect, available through the Kidney Foundation. And about 3/4, I think, of people who responded to our survey said that they had referred to that program in the past. But there's also more opportunities now with the wellness hub that we talked about, and looking at ways going forward of how can we embed a peer support component into self-management, specifically the My Kidneys, My Health tool and resources. Next slide. So the next steps from the self-management side, Mo has kind of touched on this, but as we go forward, the big focus of My Kidneys, My Health and self-management, now that we have this tool, and it's a wonderful tool, has a lot of information there. The important questions we have now going forward are how can we adapt this tool, scale it and spread it and help it to be more widely used and more applicable to more people. So specifically in this phase of our work, we're looking on how to adapt or expand the application of this tool to meet the needs of Indigenous peoples, to look at sex and gender related considerations, things like sexual health, fertility questions, how can these be embedded within self-management, and also integrating that peer support component. So we have in this phase of our work, we have a 4-year planned approach that starts with identifying these gaps and needs, creating and adapting existing tools, adding to them, seeing how we can fill those gaps, and then developing more of a comprehensive bundle or a toolkit that we can share more widely. Next slide. So I think that's all we really had to say today. If you have any questions, please do not hesitate to reach out to any of us. We are all very approachable and we love talking about this stuff. And we're easily accessible. So yeah, any questions, please reach out to us. And I think the next slide is acknowledgements. Yeah, we have lots of shout outs to give. The CanSolve CKD network has been immensely supportive of all of this work. Strategy for patient-oriented research. Importantly, we would love to thank all of the patient partners, healthcare providers, the CKD Clinic network. There are just so many folks who have helped to make this work possible. So Mo, I might turn it over to you if you want to lead the discussion. What we can do is come back to some of those poll questions. We wanted to leave a lot of time for discussion in case anyone wanted to walk through specific parts of the My Kidneys, My Health, or had specific questions about barriers or strategies. So I think I'll leave it here.
Thank you so much, Megan. I wonder if, do we want the slides up, or is it okay to put the slides down?
Yeah,
So
you can take it down, that's fine.
Yeah,
we can see each other if people want to talk. I guess first, on behalf of the kidney community, congratulations on this very impactful body of work, and I really appreciated some of those practical suggestions and thoughtfulness about what we can do. We had almost 100 people on the call, so I hope your stats spike with respect to your website hits, and would be good to have any questions, or if anyone wants to share any comments about their experiences with self-manage or peer support in their programs.
Mike has his hand up. Mike, would you like to unmute yourself?
Sure thing. Great presentation. And like a lot of these things, like you mentioned, there is all kinds of information all over the web. And it's nice to see like an attempt to consolidate kind of the best of it. I was wondering if, as part of your project, you had considered building an actual app, like a phone app.
Great question, Michael. Yeah, so when we initiated the project and we looked at, I guess, going back, we first looked at the literature to see what there is out there in self-management. We also then did an environmental scan, questions to CKD clinics across Canada to understand what they're using, resources, be it paper, electronic. And then we saw that there were gaps than what people identified across Canada, patients and caregivers, to what was there. But we also considered then, how do you want this information delivered? And so when we looked at it was going towards an e-health tool, we dove deeper into that with our questions to patients and caregivers around the mode of delivery of an e-health tool. And so good question around the app. At that point, it was a web-based tool that could be, and it has been built to be readable on a mobile device, but not as an app as of today. We track Google Analytics on the My Kidneys, My Health. We do a review every month to see, who are the users, where are they coming from, like within Canada, outside of Canada, but also the devices they're using. And we're still seeing more around the web-based side of things in terms of a desktop or laptop or tablet than an app the app, even though we can track that. So as of today, we still don't have enough information to guide us that should we truly make an app out of it, but we do have it that it's able to be read on a mobile device. Does that help?
It does. I see Melanie kind of smiling. I think she probably knows where I'm going with this. So as part of the III project, we are currently working with an app development company to build something that I think would pair very well with your website. And we had actually talked about how do we sort of direct people to our particular app and the functionality that we're trying to build off it. So I think we'll probably connect the two projects and see what we can do with it. As everyone said, no point in reinventing the wheel. Exactly.
And I'm happy you brought that up, and would gladly like to meet and discuss further and see how we can to the synergies and intersectionality of our work. That's excellent. Thanks.
Sounds good. Melanie, do you want to run that past Claire and
Yes.
Claire and
Stephanie, yeah.
Stephanie, thank you.
Yes, I will for sure. And I was thinking the same thing. I have it right here in my notes. We need to connect for sure. Yeah, thank you for
Perfect.
bringing that up, Mike.
Yeah.
Thank you, Mo.
Thanks, everyone.
Looking forward to it, Melanie. Great. Thanks, guys. Other questions? I know one big thing that was coming up in the chat is about the posters, the some of those resources that can be used by clinicians or others that can be provided. We're going to send those out through the network, or Selena, right? We can get those sent out after. Perfect. And feel free to share them. And if you think there's other products that you feel that would be helpful in terms of sharing and building that relationship with your patients in the clinical setting, let us know, and we can work on that, because that's the continued sustainability and implementation strategies that we're looking to continue supporting. Hi, Krista. I see you have your hand up.
Hi, thank you. Thank you for the great presentation. My name is Krista Riz. I'm one of the nephrologists here in Manitoba, and I'm also the director of our renal health program at my hospital. And I was just wondering, are your resources available in any other languages, and is information on the My Kidney, My Health available in other languages?
Excellent. Thanks for bringing that question up. So currently, everything is obviously in English. We are working with the CanSolve CKD network to our first language, that we're looking at the resources to be translated into French. And then we will go from there in terms of other languages. In terms of how we're determining what resources to translate, our patient partners have been working on the resources and helping us determine which ones we should, because it's meaningful to patients and caregivers. So they're directing that work. But yes, we are working, and we've talked with BC Renal and their KFOC in BC, because they've done a lot of work in that area too. So we are continuing, and I'm fortunate that we have funds, as Megan said, going forward in terms of these adaptations and building other features like language resources for adapting the website. So thanks for bringing that up. Great question.
Excellent, thank you. I look forward to getting the resources.
Okay, perfect. One thing I'll also bring up is that currently on the website, there's not a spot that we've identified this through our implementation study, for resources for both clinicians and patients. So we're currently working on building a resource tab, which will be located at the top by my questions and my food list and then have it up there so you can just quickly go to resources to be either facing for patient facing resources or for clinicians, I should say. You know, can we talk to, oh, I see Michael has his hand up again.
Sorry, one more question. So I'm just having a look at the website for the first time. And I noticed the little pop-up that said it does not save your information. So like if you move from computer to computer, is there any thought to putting a login so that you potentially could save your information?
Great question. And that did come up over as we were building the tool based on patient and caregiver feedback from across Canada. And up until this time, when we built the tool, everybody's, the end users said they didn't want that. They wanted it to be, they didn't want to have to go through a password. They just wanted to be able to go in and use the website rather than going through a multi-staged security. And that's what we would have to do, obviously, if we were to store any personal information on it. How we semi-tailored it to keep information more so around the questions, so you can, you know, click off if you have an interest in certain questions you want for different topics to bring with you to your health care provider, or add questions. You can then save that, PDF it, and that is more personalized. And same with your food list. So it's more personalized, but no clinical information or biometric information is on there. And that was based on the direction of our end users, that they didn't want it to be have to go through a password protected site. Hope that helps.
Okay, thank you.
Yeah. Joanne?
Thank you very much for this great presentation. And the question that I have, I hope I didn't miss it when Dr. Elliott was speaking, but how will you get this to primary care providers? Because early CKD is not usually seen by nephrologists or by CKD clinics. So I'm sorry, Dr. Elliott, if I missed that, but could you mention that again for me?
Sure, I think Mo should actually speak to that because they are doing some work around uptake in primary care.
So yeah, thanks, Megan, and thanks, Joanne. So in terms of the dissemination component of this, we have been working locally to see what is working in terms of dissemination methods in primary care. The big thing that we're finding is biggest uptake and to provide awareness, not necessarily, we don't know about adoption because we don't track details about each provider in primary care that accesses this site, but we do know that now that we can do face-to-face, like lunch and learns, also the webinars, but we're finding these face-to-face, word-of-mouth requests to come and talk. So for example, locally, we've done a session before Christmas with a group of primary care clinicians, and they were dietitians, pharmacists, social workers, and others, face-to-face, and just talking to them. And then they got very excited about it. And then it was like a snowball event where we then passed on information because there are other care providers in their network wanted the information. And so that's how it's just these small, but they're timely events, but it is a lot of energy and work because there's no connected way, at least in Alberta, to address primary care of clinicians. So we are doing it like piece by piece and through networks, both provincially and then nationally.
One of the things, just as to put into your parking lot, is to actually consider going to the community pharmacy or your pharmacy association in Alberta, and actually in all provinces, because everybody goes to their community pharmacist, and community pharmacists are very engaged with their patients. And so if they know that their patient has chronic kidney disease, they can direct them to this site. So I would, as part of your dissemination strategy, maybe consider that group moving forward.
Yeah, thanks for bringing that up, and a great point about that nationally. Currently in Alberta, we've been very fortunate to hook up with a group out of the University of Alberta that has a pharmacy network that is very keen on disseminating evidence-based practices and products. And so they're keen about, like, we're putting in the newsletter. They've asked us possibly to go to the pharmacy, their next pharmacy conference to speak, and that's another way. But you're right, Joanne, pharmacists play a key role in these early stage care and management for these patients. So thanks for bringing that up. I see, Kathy, you have your hand up, and then I'm going to pass it over then to Megan for Bernadette has a question about peer support. So.
Hi, everyone. Great presentation. And my question is very similar to Joanne about the primary care physician, because I was diagnosed by a primary care physician and given very little information. And so I think that's important. But I was also just working on a project last year with Dr. Tangria on physicians and we were working with a primary care network and working with them. So, you know, you might want to touch base with them, because what the project was in the video was that we created was to try to help primary care physicians to give better information to their patients, because the time lag, like I was fortunate to be able to see a nephrologist within, I think, 2.5 months, but you know, other people aren't quite so lucky. And so there's a big lag in terms of time. And I was diagnosed in 2011, 2011, and I was very reluctant to go to the network and to go to the internet and find things out because of so much misinformation. So I just my nephrologist was later on to give me information, and I think that information about food and diet is so important. My primary care physician had put me on a protein reduced diet, which I became so ill by the time I had seen a nephrologist, and a lot of that was because of I had such, like, it was like 10 milligrams, 20 milligrams of or whatever of protein. It was very, very low. So, you know, a lot of misinformation and a lot of stuff going on out there. So.
Yeah, Kathy, thanks for sharing that. And then thanks, Heather. I see you put in that we'll work with the network, CKD network, to connect with the primary care SPORE network. So that's great. I was just Megan, I saw Bernadette, and I know Sabrina had answered, but did you want to comment on peer support?
Yeah, I can comment briefly on that. So through the Kidney Foundation, the Kidney Connect program, it really varies regionally depending on where you are. Each province or branch operates things in a slightly different way. Certain areas, I know in Ontario, for example, they do have peer mentors or volunteers who are in the clinics, who come into clinics and are involved in meeting people or doing small group sessions and things like that. But it's very regionally dependent. But that's a great suggestion. I think that's ultimately what we're hoping to do at some point, is to embed a peer component into these meet and greets or welcome packages that we introduce to patients as they come into the kidney clinic. Have it just be embedded as part of the routine care that we offer.
We are just coming up to the end of the hour, and I think we had exactly the collaboration we were looking for. Selena and I have warm hearts because the whole purpose of the CKD network is to have this kind of discussion. So thank you so much for leading us. Thanks especially to Dwight for your time. This is not your full-time job. This is your other job. So we are very grateful. I hope everyone has a good day, and we will be in touch. Thanks.